A very good evening to everyone. A very warm welcome to all of you joining us today. In today's modern world, where health challenges are coming increasingly complex, there is a growing need to connect with time tested traditional wisdom that emphasizes balance, prevention, and harmony. Ancient systems like Siddhar Yogam offer profound insights into understanding the human body, not just as a physical structure, but as a dynamic interplay of energy, mind, and consciousness. These traditions remind us that true healing begins from within, but aligning ourselves with nature and supporting the body's innate intelligence. With this beautiful intention, I warmly welcome you all to today's session. Ancient Wisdom for Modern Health through Siddhar Yogam. As part of the GITA awareness program organized by Gitananda Integrative Therapies Academy. To begin this meaningful session, we have a special message from the chairman of Gitananda Integrative Therapies Academy, Dr. Ananda Balayogi Bhavanani, who will share the introductory message and set the tone for today's program. Sir, we warmly invite you to address the gathering.
Thank you, Bhuvna, for this introduction. We will start with the invocation and then we will play the video of our chairman. So let us join together. Om Tadganeshaya Vidmahe Vakratundaya Dhimahi Tanno Dantihi Prachodayate Om Om Tat Paramparaye Vidmahe Jnanalingeshwaraya Dhimahi Tanno Guruh Prachodayate Om Om Yoga Maharshi Dr. Swami Geetananda Giri Guru Maharaj Ki Jai Om Pudvai Kalma Mani Pudvai Shakti Yogacharini Amma Ji Meenakshi Devi Bhavanani Guru Mata Ki Jai Om Shri Guru Bhyo Namaha Hari Om. So namaste and warm welcome to one and all. And as Bhuvna mentioned, that we will have the video message of Dr. Ananda sir. And till now we were having the subtle presence. Sometimes Dr. Ananda sir was here with us with the physical, the online presence and all. And it was a great honor to have sir's presence, whether it is subtle or video form or whatever it is. So the message I'm just sharing, and the message is very clear, and that we all be in this path in the righteous journey. So I think it is visible.
Namaste, Vanakkam, Swagatam. Such a pleasure to be with all of you on the occasion of this awareness program being conducted by GITA, the Gitananda Integrative Therapies Academy. I congratulate our directors, Yoga Sadhaka Anandraj Bhavanani and Yoga Sadhaki Sagalakala Valli Divyapriya Bhavanani on these initiatives. And I appreciate the dedicated efforts of our CEO, Yogacharya Nilachal, who's doing his best to take this message to all of you. Gita is based on the principle that yoga and allied therapies are the way for us as a human being to grow into our holistic potential. Physical, mental, social, emotional, spiritual, and why not also financial health is vital for every human being on this planet. We must make sure that each individual receives those therapies that are appropriate to them in the appropriate way, in the appropriate manner, by the appropriate qualified, competent people. This is why at our GITA, we are taking forward these awareness programs so that all of you can understand our mission and vision. Why are we taking this forward? To reach each and every human being who is seeking care, and not just ordinary care, but loving care that comes from a noble place in our heart. Awareness is vital for us to grow. We have to be aware of our suffering if we are to transcend it. We must be aware of our problems if we are to solve them. And of course, we must be aware of our potential if we are to grow into it. I wish the successful conduct of all these awareness programs, and I also appreciate deeply all our resource persons who are highly qualified and competent in their own field. And I thank you all for supporting GITA as we move forward step by step, doing what is possible every day, so that one day when we look back upon it, we will see that we have indeed done the impossible. Loka samasta sukhino bhavantu, sarve jana sukhino bhavantu. Om Shanti Shanti Shanti.
And as Dr. Ananda sir has shared his mission and vision, I would like to just show and just give introduction. And today we will having a very detailed session. What we had earlier, the introduction, we now will be going into the depth of the Siddha and Yoga, the Siddhar Yogam that Dr. Rajalakshmi ma'am mentioned in the last previous session. Just to give a brief about what GITA is all about for those who have joined little lately or those who are watching this for the first time. And as GITA, the acronym stands for Gitananda Integrative Therapist Academy. It tries to build integrative approach, bring the different systems together where the objective is very clear to help the individual in whatever possible way to heal as a holistic well-being. And with that intention, this Gitananda Integrative Therapies Academy tries to integrate how the different modalities, different systems can help to heal the person holistically. And as Dr. Ananda sir mentions every time in his lectures, holistic with W, so whole as a person. So, Gita at its base, at the roots, it is understood by as a yoga as a therapy, which is supporting health through yoga chikitsa, yoga as education, instructional learning and professional training, yoga as a way of life, cultivating conscious and balanced living. And one of the very important aspect that is being focused, that is the root, where we are trying to make the individual, whoever is seeking health, to give them, enable them, and they can help themselves in later stage. And with these monthly awareness programs, our intention is very clear to introduce different healing systems and therapeutic approaches so that people can understand how to take responsibility, that we were talking about this every time, for their own health and well-being. And when we take responsibility on our own shoulders, then only we are able to be holistically healthy. As Swami ji mentions, do healthy things to be healthy and do happy things to be happy. So we have to take responsibility for being happy, for doing happy things and for healthy things. And Gita is not just a clinic and academy, it is a living and evolving platform where healing, education, research, and service come together. And as you all know, we are rooted in the Gitananda tradition, where the lineage is deep rooted, and this Gita inaugurated, founded on 24th July 2015 and inaugurated on 14th January 2026 this year. And all the modalities, all the disciplines come together as allopathy, naturopathy, siddha, music therapy, dance therapy, and a lot more are coming in that sequence. As you can see, the petals, that petals are growing bigger. And with that learning philosophy, with exposure, practice, application, integration, this whole thing come together. And lineage is important, and these gurus, these rishis, the divine blessings are the sources, the energies that are actually driving us to do all these activities, and these are actually helping us to bring us together and to help you understand all these different systems. And they are actually enabling us in all these awareness program. If you can see, we are only the face, the actual energy, the blessings, the divinity, the divine energy is somewhere else, which we are not seeing. Through the lectures awareness program, you can see. And definitely our Guruji, the Rishi Putra, Yogacharya Dr. Ananda Bal Yogi Bhavanani ji, is the light, the person who is actually driving us through all this path and helping us to understand the holistic approach and guiding us to get this integrative approach in a better way. So with his inspiration and guidance, we are all trying to do it in a better way. And in that sequence, we have today with another session in this month, and we will be having this sessions awareness program every month. And in this month, in the second session, we are going to explore more into the Siddhar Yogam, and like how the Siddha can help individual to heal, evolve, and transcend. So with those words, I'd like to invite Bhuvna again to take it forward. Over to you, Bhuvna.
Thank you, Nilachal, for the brief introduction about GITA. We now move to the main segment of today's program. It is my great honor and pleasure to introduce our distinguished speaker of today's session, Dr. Rajalakshmi ma'am, who holds a BSMS degree and a PhD in yoga therapy. With her deep expertise in Siddha medicine and yogic healing, she brings a unique integrative perspective that connects ancient Siddhar wisdom with modern health needs. Her work reflects a profound understanding of the Siddha principles of body constitution and balance, the role of yogic practices in restoring harmony, practical approaches to applying traditional knowledge in today's lifestyle. We truly honored to have you with us today, ma'am. We warmly welcome you and invite you to share your valuable insights. The floor is yours, ma'am.
Thank you, Bhuvana, for this wonderful explanation and description about me. Thank you, Nilachal. A pleasant good evening to all. My pranams to Siddhas and saints, and my sincere gratitude to Dr. Ananda sir and lineage and the entire team for bringing me as a part in this Gita. Thank you so much. I'm going to this session. So Siddha and Yoga in ancient times, they are practiced together. Siddha was purported by Siddhas and Yoga is also by Siddhas, mainly Agasthyar, who is considered as the father of Siddha medicine, and Patanjali. They both are rishis, both are Sishyas of Nandishwar. So these two systems, that is Siddha and Yoga, they are practiced together in ancient times. Next, Nilachal. Mainly they concentrated on preventive aspect. Next slide, Nilachal. So, a brief introduction about what is Siddha system of medicine, which was dealt in previous one, Nilachal. Previously. So, Nilachal, previous slide, please. So, Siddha system, previous slide, Nilachal.
Yes, ma'am.
Hello.
Is this slide introduction one you want?
Introduction is. Thank you. So, Siddha system of a medicine, it is an oldest traditional Indian system of medicine which was practiced mostly in southern India. So, the word Siddha means perfection or achievements. And this system is propounded by Siddhas. They were the saints. They, through their supernatural powers and wisdom, they propounded the system called Siddha system of medicine. The word Siddhi means perfection. So through their Siddhigal, that is Ashtama Siddhigal, 8 types of Siddhigal they are there, that is Anima, Mahima, Lahima, Karima, Prapti, Prakamyam, Isatum, Asatvam, which I said before in the previous session. Through their Siddhigal, they propounded this system of medicine. So this system, it provides preventive care mainly, promotive, curative, regenerative and also rehabilitative health care. As I said before, this system is having a holistic approach. They treat the individual in all dimensions of well-being. This system, it comprises of 4 parts, mainly alchemy, that is badam. Alchemy means that is the lower metals. They are the capacity to transform that lower metal to higher metal, that is gold, like that. Then medicine, with the helps of drugs, herbs, metals, minerals, and animal origin, they treated, which is called as Vaidyam, that is Siddha medicine, and yogic practices, that is Yogam, which is a form of Kaya Karpam, that is for longevity and for rejuvenation. They practice this yogic system of medicine. Then also through that wisdom, knowledge, they gain knowledge to attain spirituality. So this system, it is rooted in ancient scriptures, teachings, as I said before, by the Siddhas. They are holistic framework. They understand the knowledge of health, disease, and healing. They focus on physical, mental, and spiritual well-being, and also through their preventive care, as I said before, Yugi Vaidya, Pini Anuga Vidhi, which was stated by Therier. He described elaborately about the lifestyle, the food habits, about what all should be practiced for to be preventive, in order to prevent from disease. He gave elaborately what are the things should be followed. So accordingly, if we follow, definitely we should avoid the disease and we should be living health and well-being. So next slide. Next. So these are the fundamental principles in Siddha system of medicine, which is Panchabhudam theory. That is, what is in the macrocosm is in the microcosm also. That is, what is in the universe. Macrocosm is the universe. Microcosm is the body. So everything in the universe, including the human body, it is made up of 5 elements. That is the earth, water, fire, air, and space. For example, the Tridoshas we say, Vada, Pitta, and Kapha. They are also made up of 5 elements. Vada is made up of air and space. Pitta is made up of fire, and Kapha is made up of earth and water. So we also believe in Mukkutram theory, that is a Tridosha theory, and also Arusuvaigal, that is 6 taste. According to the taste, we can treat the individual. So also the principle of Pini Anuga Vidhi, methods of disease prevention, which is also dealt in previous section. And also Siddha system of medicine, which is has 96 tattvams, including the Panchabhuta, the Adharangal, Guna, everything was dealt with in 96 tattvam, which is very elaborate. So it is difficult to explain in this half an hour session. So we'll explain in next time. Then also that human body, it is considered, it is formed of 7 tadus, udal tadukal, namely Saram, Sinni, Woon, Kolupu, Enbu, Mulai, Chukila, Sronidam. Then Tridosha theory, as I said before, Tridoshas are Vali, Aral, Ayam, namely Vada, Pittam, Kabam. In Ayurveda, they say Vada, Pitta, and Kabam. These 3 They should be in balance. If they are in equilibrium, we say that we are healthy. If there is any disturbance or if there is any imbalance in Vali Adalayam, then we call it that person is affected by a disease. And another concept of Unave Marundu Marunde Unavu concept, that is, food is medicine, medicine is food. That highlights the importance of diet in both disease prevention and also in treatment aspect. So next is yoga. Yoga, it is a form of Kaya Karpam in Siddha system of medicine. We learn in special medicine. So it is a form of regeneration therapy, or it is a form practiced for longevity and to live long. Next slide. So classification, according to Siddha literature, we have 32 types of internal medicines and also 32 types of external medicines. A brief elaborate about the internal medicines, namely Surasam. Surasam means that is a juice. That is, for example, if you make ginger, ginger will convert into a juice form. Then we lightly will heat it. That is Surasam. We give that for specific kind of disease. For example, for anything loss of appetite or anything anorexia like that, we will give that Surasam. Kudinir means kashaya. In Ayurveda, they will say kashaya. In that form, we'll give charu, karkam, utkali, pittu, vadakam, manapaga. Manapaga means syrup form. That is with the honey and palm jaggery. We'll prepare a medicine. That is for mainly we'll give for pediatric conditions. Nei, ilagam. Ilagam means legium. The medicines, the particular herbs, drugs will be changed into a legium form. So it will mix with ghee, we'll mix with honey, we'll mix with sugar. Then we'll give in order to some medicines will be very bitter or pungent. So in order to transform that taste, we'll change it to a legium form and we'll administer to the patients for different ailments. Then tenural means with the honey, we'll some ginger itself, we'll make into pieces and we'll put it in the honey, and then after for 5 days or 6 days, we'll give the patients. Then teeni, vennai, rasayanam, churnam. Churnam means herbs, we'll make it into powder form, the polyherbal formulations we are having. So we mix all the herbs and then we administer. Chunnam, parpam. Parpam, chendurumadol, they have the lifespan for 75 years. Once it is prepared, we can give for 75 years, 100 years. Then matre means in tablets, pills form, which has a lifespan of 1 year. Then kattu. So internal medicines, they have life period from for a period of 3 hours to 1 year. They act even in very small quantity, and they are capable for curing many chronic ailments, and also acute and chronic ailments they are capable of curing that. Next, nilachal. So external therapies in Siddha system, they are also of 32 types, and they are mentioned in Siddha text. Most of them they are practiced even today. First is leech therapy, even we all know, and it is used to eliminate the unwanted blood, that is impure blood. Toxins are removed through leech therapy. We'll administer the leech on the affected part, and the leech will suck the blood, and it will just after sucking the toxic blood, it will leave the point. If it is not leaving, we'll apply turmeric powder, then it will leave. So for each individual, fresh leeches will be used and they are properly preserved. Then also patru, application of the herbs. We'll make it a paste and then we'll apply on the affected part. For example, for knee joint pain, any inflammation, we'll apply particular herbs. Then otradam, fermentation we'll give. We'll mix some herbs, then we'll make it into a form, then we'll make it a powder or just leaves, then we'll heat it, then we'll apply in as we shown in the diagram. Then nasiyam means nasal drops we'll give to a particular patient with medicated oils. Kattu, as we all know, it is a bandage type. Then tuttikai means applying heat therapy, we can say, that is cauterization for a particular individual. That particular points, vital points are there, which we will apply, and then that problem will be solved. Next. Then there is also steam inhalation therapy, fermentation therapy. Like this, 32 types are there. Steam therapy, it is very good for sinusitis. Nochi, Vitex nicundo is the botanical name. So we'll use that herb for steam therapy. then the sinus problems will be revealed. Like that, we are having many external therapies. So how we'll diagnose the disease in Siddha system of medicine? So we have 8 types of diagnosis. How we can diagnose? By using Nadi. Nadi means pulse diagnosis. You will see whether which humor, that is Vadam, Pittam, Kabam, which is affected. So accordingly we'll treat. Then by seeing the tongue, any discoloration or any whitish thing is there. By seeing the tongue also, we will be able to recognize which humor is affected. So niram, skin tone, whether it is blackish or yellowish or whitish or whether it is dull, like that we'll see, and accordingly we'll treat the patient. Then mori, whether they are speaking normally or whether any problem is there, whether they are able to there is any difficulty in speaking, like that, any modulation, or whether what are the difficulties, accordingly we'll give the treatment. Then we by seeing the appearance of the eyelids we'll diagnose. Then sparsam, by means of touch. Then fecal examination also. Then analysis of the urine, which is main in the diagnosis. Neerkuri and neikuri. Neerkuri means just by seeing the urine, whether it is frothy or any coloration is there, like that we'll analyze. And also neikuri, which is a type in that. Next, in other slides I'll show. It is a type of diagnosis in which we'll take a container, that is a glass container, and we will pour 100 ml of urine, patient's urine, in that container. Then after it is standing still without any disturbance of the wind, we'll just instill a drop of gingerly oil, that is sesame seed oil, on the urine, and that oil will spread in the urine. If the oil is spreading is very rapid, or if it is like a sieve plate, or if it sinks, or if it half sinks, or if it disperses very rapidly, then we'll say that that condition is very severe. So we have to
There is some network issue from uh, Rajalakshmi ma'am. She's joining again. Yes, ma'am. Uh, you got freezed, I think. Mm, yes, ma'am. You're not audible, ma'am. Yeah. No, ma'am. Something is not connecting. Uh, uh, Now I think it will be audible. Please say something. No, ma'am. Bharataji, can you hear Rajashi ma'am? If you can confirm? No, no. Okay. Yes. So I think maybe with the earphone that you are using.
nilachal sir ఇన్వర్ట్లేదు నాట్ లిజనింగ్ మేడం కోసం.
Yes, yes. We are trying to connect it with mics. Just give us a moment. No, ma'am. You're not audible.
You can log out and log in again. You can try it once.
Mm, just check the settings, ma'am, if possible, or like you can log out
It's
and
8 o'clock.
log out and log in. Just check, ma'am. And till that time, requesting all, just like last time also, you had some questions related to Siddha, Ayurveda, the concepts that we all are having in this session. So please keep typing. And also just letting you know that in this session, we are also trying to have questions and we will be answering them. And as mentioned earlier also, we are having this session just to give you an idea about how in Gita Nanda Integrative Therapist Academy, we're trying to bring all the therapists together, and we have a very good team of very specialist doctors in different expertise in different therapies, and the consultations are uh, given in that categories in different whatever therapies you want, and we are ready to help you in that scenario. So whoever are having any issues, they can consult in that way. Yes, I think Rajalakshmi ma'am has joined again. Can you try once, ma'am? No, ma'am. I think you are connecting with your earphone. Just can you remove that or disconnect from your laptop and just try with your system mic? I think that may help. Uh, you need to disconnect from your Zoom settings as well, ma'am. And thank you all for your patience. And this is a very important session where I have seen the presentation, the PowerPoint slides that ma'am has prepared, and it's very detailed one. And I'm really sure that you will get a lot of things from this. And ma'am was giving a very brief and the introductory part of this. And please stay tuned with us, and we will just get back in a while, I think. And ma'am, if you can join with mobile also, that is fine if you can, and I will be changing the slides if that is possible. And again, if you have any questions, you can type it out or you can share. And till now, we have a lot of sessions covered. We started on the 8th of March on the Women's Day, and it was very auspicious where Dr. Lotika and Yogacharya Diya Ram Rakshani ji took the beautiful session, and we had a lot of things came up on women's health. And later on we have the naturopathy session with Dr. Vasundhara ma'am, and we had a lot of understanding, and we are now planning with a lot of other things in this scenario. And in upcoming sessions we will be understanding a lot about the music therapy. Like we have a session on 29th of this month where the second part of the music therapy will be taken by Miss Utpala, and she will be taking a detailed experiential session. So just giving you a glimpse of the sessions that are coming.
Hello, I'm
Yes,
joined by phone.
yes, ma'am. You are audible.
Okay.
Ma'am, can you mute your system or something like that because it is echoing? Can you say something, ma'am?
Hello.
It is echoing, ma'am. Your system, ma'am. You are using two systems.
Okay, I'll close my laptop. Okay.
Yes, ma'am. Please, ma'am.
Okay.
So all of you, good news that we are back with Rajalakshmi ma'am. So we will not miss that very important part of this whole scenario, whole presentation. So yeah, over to you, ma'am.
My
Everybody say
apology. Sorry for this inconvenience which is caused by me. Now it's audible, it's clear, Nilachal. Can I?
yes, ma'am. It is audible, clear, and loud,
Okay.
ma'am. Please,
Okay.
ma'am, continue.
So what now I was talking about Neikuri. That is a important diagnostic tool in Siddhar system of medicine, which is stated by Saint Therier. So accordingly, we have to take a glass vessel and then we have to pour 100 ml of urine, that is patient's particular patient urine, and then we have to instill a drop of gingerly oil on that, and we can watch the spread of the urine. So I said previously, if it is fast spreading, or if it is half sinking, or if it is spreading like a sieve plate, then we can say that the disease is a severe one and it takes much time to be cured. But if it is a Vada type, then the spread will be like next in Lachan. This is what I said. Procedure. Time of collection should be in the early morning. Then the procedure is the urine sample will be placed in the petri dish under the sunlight, which should be undisturbed by the wind. A drop of oil is dropped into the urine sample, and we have to watch the pattern of spread of the oil. So during observation, what all we have to observe is that pattern and the direction of the spread, and whether it is sinking or half sinking or it is dispensing, and the shape of the spread, whether it is turbulent or whether it is circular or whether it is oval or any shape. Next, Nilachal. So these are the types of spread. So if it is a valley humor, we can say that that oil will be like a spreading of oil will be like a snake. It will be fast spreading and the spread will be very irregular. Then if it is a pitta type, that oil drop will be in a circular shape, that is like a ring shape, and the spreading will be regular. If it is of a kaba type, the oil will be standstill like a pearl. The spread will be very slow, or the spread, there will be no spread at all. So we can come to a conclusion whether the person is affected by Vali or Aral or IM according to the Naikuri. The next. So the materials which are used as drugs by Siddhas, they were classified into three types. That is, first we'll use herbal origin, then metals and mineral origin, and also animal origin drugs are used in Siddha system of medicine. So herbs means we'll use single therapy also, single herb, like what to say, we'll use tulasi, for example, that is Osmum sanctum. That drug, single drug also we'll use. Then polyherbal formulations, like many other drugs are all 5 or 6 types of drugs, even 56 types of herbs also we use, and we'll mix and we'll give in churna or elehia or kudini type also we'll give. That is known as polyherbal formulations. And there are different plant parts are used. That is, we can use roots, leaves, stem is used, flowers are used, seeds are used, like the bark is used, and the pollen things are used, the flower petals are used, the latex is used, the resins is used. All the parts of the plants are used. Sometimes the whole plant is used as a medicine. And we use even the herbs, we'll use for processing the metals and minerals also, we'll use the herbs. And also even the animal based products also, we'll use the herbs for processing as a medicine. Then materia medica, as we all know, we have many varieties of plants, and it is very useful book one should learn about all the plants, its significance, its importance, and its medicinal values. So herbs which is not available, why we are using metals and minerals and animal origin means for some time the particular herb will be not available throughout the year. So Siddhas, they thought like that, and they used metals and minerals for the treatment. And also Anubanam. Anubanam means catalyst. For example, for churnas and all, we'll ask the patient to mix with honey, or we'll ask the patient to mix with milk or hot water or ghee. So that medicine's potency will increase. So this Anubanam, that is the particular honey or milk or hot water or buttermilk or ghee will act as a catalyst, and this aids the medicines in all the ways. Its potencies will increase, and all the healing power will be increased. So usually we'll advise a patient to take with the Anubanam. Next, Nilachal. Then how we'll use the medicines, Siddha medicines? First, we'll use the herbs initially. We'll treat the patient. If it is not responsive, or if it is not giving any cure, if it is not giving any symptomatic relief for the patient, then only we'll use metals or minerals and also higher order medicines. But initially we'll give only herbs, that is the stem part or the root part or the whole plant or the latex of the particular herb and so on, or the root tubers also we'll use. Next, these are the roots, then leaves, then parpam will be in a like a form of a powder, white powder, and chendurum will be in a form of a red. Mostly it will be as a dark red in color. So these parpam and chendurum are higher order medicines, metals and minerals. So these metals and minerals will be prepared with the help of the herbs like decoctions and all. So therapy in Siddha medicine, They will use first, we'll use Kaya Suddhi Pariharam, that is biocleansing therapy by means of purgation or by means of emetic therapy or fasting therapy, like that we'll use. Initially, before treatment, we'll give any purgation or emesis and then only we'll treat the patient. So next, Maruntuva Pariharam, that is drug therapy we'll give. Then while giving the drug therapy, we'll advise diet also and lifestyle changes also. Then also Kaya Karpam therapy. That is important in the system of medicine. There are many medicines which is used for anti-aging therapy. I'll delve afterwards. Next. So restoration of balance. As I said before, Vata, Pitta, Kapha. If it is in balance, we say that we are free from disease. If it is in imbalanced form, then we are having disease. So initially, if the Vata or a Pitta or a Kapha, it is changing from the normal stage. So we can restore easily by simple herbal medications, lifestyle modifications, or also dietary modifications based on the humor which is affected. So if we are not restoring the imbalanced humor initially by our lifestyle changes or dietary modifications, then disease occurs. Then only we'll give cleansing therapy. Then after giving that cleansing therapy, we'll administer drugs, particular drugs. So if the Vadam is imbalanced, certain principles are used so that disease will not occur. We can follow these principles. That is Tokkanam. Tokkanam means massaging with the help of medicated oils. Oilation, that is oil bath, taking oil bath. Nowadays, we are not taking oil bath, but we have to take once in a week or at least twice or once in a week. So stay warm. Vada people should not be in cold places or not take any cold things or not any cold items or like that. They should not take. They should be in a warm place. They should be easily. They should take easily digestible food and early to bed. They should have adequate sleep. Then they should eat oily, heavy foods, that is sweet taste, sour taste, and salt taste foods. And also, they should avoid raw foods. They should avoid fasting, excessive exercise, because these Vada people, they will be very fast in their actions. They will talk very fast. They will move very fast. They will be always in a stressful condition. So accordingly, we should give the diet, and they should definitely, they should take adequate rest also. Then coming to Pitta type of any imbalance, they should avoid hot weather, hot foods they should avoid, because Pitta is related to metabolism. So their fire, Pitta is fire. So digestion will be very severe. So anything if you give, they will digest. So they should take cool, heavy foods. Then they should also take a sweet, bitter, astringent foods also. And activity should be in moderation. Then also these people should avoid fasting, because being a Pitta individual, they will have burning sensation if they do fasting. So they should avoid fasting also. And they should take regular meals. And also they should restrict warm, oily, light foods. Then for coming to Kapha patients, Kapha patients, regular exercise is must, and warm temperature, fresh fruits, it's advisable, and also vegetables. Then taste like pungent, bitter, astringent taste foods they should take. And these people, they should restrict heavy, oily foods. And also sweet, sour, and salt foods should be avoided. And they should sleep less hours, because sleep promotes Kapha. Next. So coming to oil bath, that is Ennai Murukku, which is most important in Siddha system of medicine. Usually in Vata type of disorders, we advise oil bath with medication, with medicated oils. There are some oils are there. For example, Chukutailam, then Nochi Tailam, like that. We'll advise the patients to take oil bath. Oil bath, there is a particular procedure to take oil bath. That is not, it is oil bath means we should not take only oil, apply oil on the head. We should apply oil on all over the body. And even 2 drops of oil should be instilled in the nose and the ears also, and we should take bath only with the warm water, not with the cold water. Then we should, during that day, we should take mild food only, and we should take rest. We should not sleep in the afternoon also. So, ennai kuliyal, that is oil bath. This is a important cleansing therapy in the system of medicine. So, regular practice of having oil bath is must. It regenerates, it relaxes the body. So, several medicated oils are there, as I said before, namely Chukutailam, Nochitailam. And Siddha, they have a particular procedure of how to take the oil bath, and also we should not, we should gently massage without any heat emission. That is a must in Siddha system. Then oil, there are many oils according to the body's constitution and also disease conditions. We have many types of oils which is used for ennai kuliyal, that is for oil bath. So taking oil bath twice a week, it is advisable. It also prevents diseases. Also for particular diseases, we are having a particular oil, and also to prevent disease also, we have particular oils. So it gives good skin complexion. Then many dry skin, it is very useful. It strengthens the joints particularly, and also the sensory functions it enhances. It prevents many head related diseases, particularly it promotes hair growth and so on. So benefits of oil bath, they are mentioned in Siddha literature, Padartha Guna Sindhamani. Next. So Varmam therapy, it is a particular therapy which is used in Siddha system of medicine. There are some points, vital points. 108 vital points are there, and these vital points, when stimulated, they treat a particular disease. So these, for example, here, Tiraltha Varmam is there. That is between the eyebrows. So if we stimulate this, it will be very essential, important for memory and all. So there are many points are there. Accordingly, we can do, and we can cure a particular disease. Next. So Tokkanam, as I said before, it is a massage therapy. So we have a structured massage technique. So accordingly, we have many oils, medicated oils, and we'll use a particular technique. For many Vata type of diseases, we use this Tokkanam. So benefits of Tokkanam is that it tones the skin, muscles, and also nerves, and it eliminates the excess toxins in the body, and it gives nutrition to the muscles, and also it reduces the body pain. It gives a good sleep definitely, and also it rejuvenates the body. Next. So Kayakarpam, as I said before, it is for rejuvenation and longevity. So Siddhas in Tirumandram, he says, Karpathai undal kayam azhiyadu, karpathinale kanalam kailaye, karpathinale kanalam jodhiye, karpathinale kalayam kattide. So he says the importance of Kayakarpam, that is, through Karpam we can attain spirituality. So there are many Kayakarpa drugs. This is a simple Kayakarpa drug which is used. First morning we can take ginger, and afternoon we can take dry ginger, and evening we can take kadukai, that is Terminalia chibula, in a kashaya form or any other form, so that definitely we can rejuvenate our body through this type of medicines. Next. So these are the Karpa type of medicines, that is Kadukai, Nellikai, ginger, Seendil, Punnangani, Kiranalli, Karisalai, Amukra. Next. These are the medicinal plants which are used for respiratory ailments. For example, Tulasi is very good for respiratory cough and cold. It is very good for this one. Then Adadoda vasica, its botanical name, it is very good. It acts as an expectorant. Then Karpuravalli, we all know, that is also very good for respiratory problems. Next. These are the drugs which is used for respiratory ailments. That is pepper, ginger, tippali, citrarthai, turmeric, omum. Then next. Tirikadika churnam, which is most essential, which is very much useful in the system of medicine. It comprises of ginger, pepper, and tippali. This is mainly useful for all the sinusitis problem and all the head problems, head diseases. It is very useful. Then Tripala, Kadukkai, Nellikai, Tandrikai. This is also very good. This is having a rejuvenative power, and also it is very good for geriatric problems, and also it is a laxative. It has multiple benefits. Next. Then these are the things which is very useful for diabetes. Jamun, as we all know, gooseberry is very good. Seendil, Sirikurunjan, then fenugreek, then bale. These are we are using in medicine form also, in different powder forms also we'll use. And this is very useful for hypertension, banana, beetroot, garlic, bottle ground, cardamom, cumin seeds. Next. Then some of the medicinal plants, Adadoda vasica, which is very useful for cold, cough and asthma. Next. This is Amukra, Vitania somnifera. In Ayurveda, it is known as Ashwagandha. It is a very good plant which is used for Vata type of diseases and also for many neurological problems. This is Gingiber officinale, that is ginger, which is very useful for cold, cough, and very useful for digestive disorders. Next. This is Piper nigrum, that is milagu, pepper, which is very useful for Vata type of diseases, Pitta type of disease, and Kaba type of disease. It is a Kayakarpa herb. Then coming to my thesis work, which was done in Mahatma Gandhi, thanks to my guide, Dr. Meena Ramanathan Madam and Dr. Ananda Balayogi sir, for their support and guidance. So this is the effect of integrated yoga siddha module in the management of type 2 diabetes. Actually, we termed it as YOSI. So why yo? Yo for Yosi and SI for Siddha and YO for yoga. So combinedly we did as a Yosi module. Yosi means to think. So to think, to be healthy. So aim of the study is to study the effect of integrated yoga siddha therapy in the management of type 2 diabetes. So objectives is to evaluate the effect of yoga therapy and siddha medicine on anthropometric like body mass index, waist circumference, physiological heart rate, systolic blood pressure, diastolic blood pressure, biochemical tests like fasting, postprandial, HbA1c, HOMO-IR were all done, and psychological parameters such as perceived stress scale and quality of life. Then also Siddha parameter, as I said, Neikuri was also seen to see the effect of this model. Actually, we integrated both Siddha and Yoga, and we found that this module is very effective in the management of type 2 diabetes. Next. So this study was done in Primary Health Center, Rediyarpalayam, and the patients who are coming to Siddha OPD, they were assessed for eligibility, and the inclusion criteria is the type 2 diabetic patients who are taking Siddha medication, whose HbA1c will be between 7% and 10%, their age limit 30 to 70, and those who are willing to participate and able to perform the technique were included in the study. And the exclusion criteria is that the patients who are taking allopathic medication for diabetes are excluded, and the patients with diabetic complications were also excluded from the study. So accordingly, 24 subjects were excluded, and the remaining 108 subjects were evaluated. So the parameters are BMI, waist circumference, as I said before, HOMO-IR and all. Then 108 subjects, through their willingness to participate in yoga or siddha, they were divided into YOSI, that is Yoga Siddha module group, and Siddha group. N number is 54. And 4 months they were intertwined. YOSI group is intertwined with the yoga and siddha, and the siddha group with only siddha medication for 4 months. And after 4 months, post assessment of all the parameters were done. Next. So these are the yoga protocol which is done. Actually, first week we did some jatis, talasana, arthakadi, nadi shuddhi. Then next week, second week, we increased the asanas according to the patient's flexibility and their capability. Then third week, we increased some more techniques, Pavana Muktasana, Uttana Padasana, Nadi Shuddhi, Brahmari. And fourth week, Jadra Parivarti, Vibrida Karni were added. And after that, all the techniques were included till the 16th weeks, 4 weeks. So these are the medicines, Siddha medicines we gave, which include Madhumehano Churnam. which included that seendil, kadukkai, korekkilangu, kiyanalli, jamun, nellikkai, and kariveppalai, that is curry leaves. And also triphala churnam is added, kiyanalli tablet is also added. In this study, I wanted to highlight the stress levels of the patients. Before intervention, the OC module had 83% of moderate stress and 3.8 higher stress level. After intervention, they were converted, all the subjects for having moderate stress, they are converted into 81.1%. That is, they are converted into low stress levels. Similarly, in Siddha also it happened, but comparatively, OC module, higher percentage of the subjects who are converted to low stress were higher, 81.1%. Next. This is the Naikuri video. Actually, we are having time, Nilachal, to play.
Yes, ma'am, I can play it.
Okay. So actually, we are putting a gingerly drop of sesame oil, that is the oil, on the urine surface. It's spreading like a map. So it is having irregular spread. So we can decide that this is a Vada type of. Then after intervention, there is no irregular spread. It is very circular. It is very rounded. In Siddha, the prognosis, if it is round, circular, we consider that it is a good prognosis. So from this, we can conclude that after treating, the patient is responding to the treatment. So likewise, we did we made videos with Naikuris for 108 patients before and after treatment. So in this thesis, we concluded that OC module showed significant role in improving physiological parameters. It enhances glycemic and lipid profiles. It reduces stress, and it's also improved the quality of life. Next. So overall, these findings highlight that integrated OC module, apart from providing multidimensional benefits, which is also cost effective, which is beneficial, and it is a holistic approach. So it also enables the patient from getting complications. So it prevents complications also. So next. So these are some of the photos we took during the intervention of the patients in PHC Reddyarpalayam. The next. Then next, some of the research papers we did, and yeah.
I will be sharing these
Yes.
research papers and all, and yeah.
I'm sorry I have to go fast because of the lack of time.
Yes, ma'am, I think that's it. And ma'am, there is one very basic question again, it came, and just to give what is the difference between Siddha and Ayurveda in just 1 minute, if you can elaborate,
Okay.
and we
Okay.
can conclude this session.
Actually, Siddha is mostly prevailing in southern part of the India. So it is a Tamil medicine. Ayurveda, they will be treating, it prevails in northern India. So it is from Sanskrit. That is one point. And another point, we have herbs. They are also having herbs, metals, minerals, everything what we have, they are also having. Mainly, they will say that accordingly, considering our lifespan is 100 years, first initially during birth for 33 and a half years, they will say that initial period is Kaba period. Then middle period is Pitta, and end period, that is afterwards, they say that that period is Vada. But in Siddha, we say initial phase is Vada, then middle period is Pitta, then final phase is Kapha. That is the main difference. And different combinations we'll use differently. But mainly we'll use herbs, metals, and minerals.
Yes, ma'am. Thank you so much for that. And again, just letting the participants who are here and who will be watching later on. So we will be in the upcoming sessions, we will be getting more into the practical, how to understand your Vata, Pitta, and Kapha diagnosis in very short, and a lot more practical sessions in that. So stay tuned with us. And for next part, I would like to invite Bhuvna. So please, Bhuvna, take it forward from here.
Thank you very much, ma'am, for that enlightening and insightful session. Your presentation beautifully highlighted how Siddhar Yogam is not just a system of healing, but a way of life that encourages us to live in harmony with nature and our inner constitution. You have helped us understand how ancient wisdom continues to remain deeply relevant in understanding modern health challenges. Thank you so much for this wonderful session. Today's session reminds us a powerful truth. The answer to many of our health challenges already exist within us. We simply need to awareness and the right guidance to access it. Teaches us to observe and understand our body, align with natural law, cultivate balance in lifestyle and thought, support the body's natural healing process. Through such awareness, health becomes not just a goal, but self-discovery. Ma'am, for that, and I thank you all for the presence and participation. We hope this session has inspired you all to reconnect with the wisdom within and take a step towards a more balanced and conscious way of living. Thank you all.
Thank you,
Getting
Bhuvna.
clear?
Thank you so much. And thank you, everyone, for joining. And thank you, Bharataji, for taking out your valuable time and joining us and listening so patiently, and everyone also, with irrespective of some internet glitches and the disturbances. So we don't have control over that, but you were there. So thank you so much for being here, and we will be coming up with another a lot of more awareness sessions, and you're most welcome to be a part of this whole awareness program, and keep helping us, encouraging us by joining, spreading the awareness that you are getting. And the idea is always to help understand that the responsibility of health is on our own shoulders. So we are ourselves responsible for our own health. So yes, so with that, we will conclude today's session. And if you have any questions, please keep updated with the mail, social media, wherever you find the link, wherever you get in us contact. So with that, we'll conclude with Loka Samasta, and we will meet again hopefully in the next session on 29th, which is the music therapy. And I just let you know that it is a very in experiential session, and last time we had a very good one. It was really amazing. I will say like amazing. So it was a great session, so I would like to invite you all for that session as well, and see you on 29th on music therapy awareness program. So let us invoke the Shanti mantra all together. Om Loka Samasta Sukhino Bhavantu Sarve Janaha Sukhino Bhavantu. Om Shanti Shanti Shanti. Om. So thank you everyone. Thank you Rajalakshmi ma'am for this beautiful presentation. We will see more from you, and we'll keep reaching you for more presentations, consultations, and thank you so much, and thank you everyone. Namaste and pranam.
Thank you all. Thank you.